Montero.
Hola, este es David Escarpeta.
Hola, soy Daniela Barroso.
Hola amigos, soy Cristín de Clario.
Hola, somos Blessed.
Hola mis amigos, soy Benjamín Rivera de la tribu de Benjamín.
Hola, ¿qué tal amigos? Les habla José Adrián Romero.
Hola, soy Andy Alemani.
Hola, ¿qué tal mi gente? Les habla Alex Zurdo y a todos los que están en sintonía.
Hola amigos, soy Alex Campos.
Hola amigos, les saluda Lucas Consuegra de la banda Living.
Hola amigos, te saluda Mónica Rodríguez.
Hola, ¿qué tal amigos? Les saluda Josué del CID.
Todos ellos, sus mejores canciones y muchos más hacen parte de la programación de Aliento Radio. Estas son las redes sociales oficiales de Aliento Radio: Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube. Encuéntranos como @Aliento Radio Oficial. Aliento Radio Oficial.
Welcome to another podcast of Avatar Home Health and Hospice. Today, as usual, we're going to talk to you about not only what Avatar Home Health and Hospice does, but a little bit on how we help the veterans. And to help me do this is Maya Arguez. She's our director of medical, got wrong title, just of social media. And Maya, go ahead and help me out.
Yeah, thank you. So as you said, we are going to talk about a specific group of patients, which is our veterans. And we are going to talk about a program we're a part of, which is called We Honor Veterans. So we're kind of going to deep dive into what that means and what kind of care is out there for veterans and for their families. So let's start with the basics. What is We Honor Veterans?
So We Honor Veterans is a program that the VA came up with in order to help the providers of services to the veterans understand the issues that are unique to the veterans. For instance, some of them were in the Vietnam War, or some of them, I don't know if the Korean War, we haven't run into any of those veterans, but certainly any of the wars that we have had, like the veterans, the wars in the Middle East. And when you're in battle, or when you're into like such stress situations, or just to being in the military alone, it could be, for some people, it could be very stressful. And when they come out of services, they need a special treatment. So you have to know how to treat the veterans, right? Some of them are great. They've got no special issues, but other ones, you have to treat them right. So this program is where we get trained on how to deal with the veterans. And it's been very, very beneficial for us. Because to begin with, what it does is it makes you aware, because you're busy on your everyday life, and the veterans, we thank the veterans for their services, but then we let it go at that. But no, these people have sacrificed a lot for all of us, and that needs to be recognized. So they need to be treated with a lot of not only respect and dignity, but we need to honor them. And that's where the name We Honor Veterans come. So they have different levels for the agencies, and it could be an agency, could be a hospital, anyone that provides health services to the veterans. So what you do is you enter, and then you start being basically trained. They give you videos to watch, and you participate with other providers, and slowly you get into what it takes, right? And so as you progress, they put you in different levels until you or your agency graduates, and that's what we're looking forward. We started doing it years ago when they was a little bit different. They had 4 levels. 1, 2, 3, 4. And we were in the middle of the 4th level, and the middle of the 3rd level to go into the 4th level. When, because of different circumstances, we stopped. Not that we stopped treating veterans, but we stopped that process. And now we're back into it. Now they got different levels. Now they have silver and gold. So we're silver on the way to becoming gold.
Right. So with that program, their kind of ideation is that they're built around 3 things, which is a respectful inquiry, compassionate listening, and grateful acknowledgement. So do you want me to dive into those a little bit? Or
Yeah, you can. You can start.
So number 1 is respectful inquiry, which means that we want to ask details. We want to have questions that they can tell us, not just were they in the military, but when, where, what branch, what was their experience, and be able to really hear their stories, but also so that we can plan our care around what they've been through.
Right.
So why do you think that that's not already like standard practice within other hospice and home health agencies?
Well, I mean, each agency is independent, and they might not want to do a lot with the VA because depending on the services that you're providing, like when we used to do a lot of home health with the VA, and this is when we kind of stumbled because we were having a lot of difficulties getting paid. So it got to the point where, and I'm going back years ago. Again, we haven't gotten into that part yet, but we've been doing this for 21 years. So back then, I'm talking at least 10 years ago, we decided if the VA cannot pay us, we cannot continue to provide the services, right? Now I believe that under the new programs with the VA, we're faithful that we will not have that problem. But with us, I mean, what other agencies do, there are other agencies that are 100% gung-ho on the program. Other ones are thinking about it, so it doesn't matter. For us, now we're gung-ho. We're going to do hospice services. We're going to start with the hospice services. And then as we progress, we might expand into the home health. But I tell you what about getting to know the veterans personally. I can tell you a little bit about an experience that I had. So we get a new patient from the VA, and I talked to him on the phone, and he lived in Conroe. So we serve all of Harris and Montgomery County. These are huge counties, and a little bit around the peripheral of the 2 counties. And I started talking to this fellow, and he says, no, Felix, but you got to come and meet me in person. I like to talk to people face to face. And I'm a history kind of blog. I mean, I like to read about history and so on. So I said, okay, sure, I'll go. And this fellow was a Korean veteran. So I don't know if anybody knows anything about the War of Korea, and I'm not going to go into it, but these people went through hell because they sent them into Korea in the mountains in the winter, and they had no winter clothes, no winter boots, so it was awful. So I went and met this guy. He's living at the end of Conroe, which is more in that part of Conroe. It's very rural, and they were a group of small mobile home campers, very small. And this guy lived like in a 10 by 20 camper, very small. And he starts talking to me. And to my amazement, he was a machine gunner in Korea. So he started telling me stories. And then all of a sudden he says, wait, they wrote a book about my battalion and they talk about me there. And he pulls a book and he says, would you? And it was his only copy. So I said no. So I copied down the name of the book and I bought it. And it was like an adventure. So yes, for me, we gain so much in knowing our patients. And in this case, we're talking about veterans, but even our patients, especially those in hospice, that are very special to me and to the agency. But personally, I'm kind of attached to those patients in hospice because it's a very difficult time in their life. They're basically in the process of accepting the fact that they're going to die soon. So there's a lot of things that are happening in their minds, right? And then they become very vulnerable, many of them, and they want to talk to you about their lives. And it's so nice to get to meet people, and they tell you where they were born, how they grew up, and if they had a paper route when they were a child, and where they went to school, whether they went to the service or not. And it's just a wonderful experience. I don't know about them, but for me, I have learned so much from my hospice patients that to me is really rewarding. So, but once you get to know somebody better than just, hi, my name is Felix, I'm from Avatar, and yeah, you're John and you're my patient. Once you get to know them better, then you realize that this human being that is in the final days or weeks or months of their lives needs your help. And you become very important to them, and they just make you a better person.
Right.
Because you have to, we do help these people, cross the final bridge, right? So, yeah, I think it's super important to get to know our patients, the veterans, and then again, I know I switch back to the non-veterans, but yeah, and we do that with pleasure.
Right. So why does or how does military service actually change what our end-of-life care can look like and how we treat patients?
Well, the most important thing or the main thing is that these people, number one, they need to be recognized. They need to be honored. So one of the things that we do when we admit a veteran to our services, we will bring a certificate. And depending on the branch they serve, that certificate is from the branch they served. And we fill in their information. We put them on we put the certificate on a frame. And when we go meet the patient, maybe not the first time or the second time, we bring the certificate and we present it to them and we thank them for their services.
Right.
So, recognition, if you read any books on what motivates a human being, recognition is one of the main. People say, well, money and sex and this, which is all power, which is all true. But recognition, if you want to get on somebody's good side, employee, friend, neighbor, just go up to them and compliment them or something. And then you're doing a very good job. I really appreciate that you fix your garden. Your garden is beautiful. That will be with a neighbor, right? So all those little things that we do could make a big difference in the relationship that we have with that other human being. So it's number one, it's very important to recognize their service, so they understand that we appreciate what they've done, right? And number two, we have to, that way we can serve them better. And once we do that, and when you do the recognition they deserve, you find out about their service and about their lives, then you're in a better place to serve them. And believe me, the relationship that develops between the patient and I mean, in some cases myself, some cases the nurses, but in general, the relationship between the patient and the agency and Avatar Home Health and Hospice is better than most because we really know each other. Mm-hmm. And that's part of the whole idea.
Right. And another reason why we've been taught to ask those questions is because where they served and what they experienced there can impact their health.
Of course.
So, for example, if someone has been in Iraq and Afghanistan, we're taught that burn pit exposure is more common. So that's something that would impact their plan of care. Agent Orange from the Vietnam War, that could impact their health as well. And those are oftentimes things that can come out towards the end of life when our bodies are weakened and everything's kind of happening at the same time. So how does that impact the benefits that they receive when we get to know these things?
Well, actually, the benefits will be that they might need more, for instance, more counseling. The chaplain, because now we get into different things that we do for a patient in hospice, right? So the nurse, of course, needs to know because if there's something contributing to what they're going through now that they're bringing in from their past, like you mentioned, the different things that they use in war, right? Then if we know that, our medical director gets involved, and then if there's anything special that we need to do to combat that, we can do that. But I think it's more on the psychological and on the emotional and spiritual side, and that's a very strong point of hospice, is that when a patient comes into hospice. And this is in general, whether it's a veteran or a non-veteran, when somebody comes into hospice, medically, there isn't much we can do for them because that person is already, as a final, has a terminal illness and is going to die within a certain limited amount of time. But So medically, all we can do really is to make them comfortable, make sure that they're as pain-free as possible, that they're having regular bowel movements, that they're eating, basically they can eat whatever they want, but that they're getting fed well and so on. But where the big difference in hospice comes is the spiritual and the emotional. Mm-hmm. Because some people are in their deathbeds and they're holding on to something that they did when they were, 20 or 15. And that is keeping them from being able to say, okay, I'm dying and the Lord is going to receive me if they are of faith, or even just to die with a clear conscience. So our social worker or our chaplain might talk to them and encourage them to tell them, so is there anything that you're holding back that you would like to share with me? And it's okay, I heard all kinds of things. You don't have to be embarrassed. I've done pretty hard things in my life also. So you got to get yourself down to the level, whatever level that person is, because maybe in the case of a veteran, they had a real bad experience and they say they threw a grenade and they killed a woman and a child, right? So they're carrying that in their conscience. And war is hell, and you have to allow them to forgive themselves. And I know that they're forgiven, So, when I get into this type of conversation, of course, it's very emotional for me because I really feel for our veterans. I mean, they gone through hell and back to help us live a free life. and many times it's not recognized. And if I remember, because I'm very old, I keep telling people I'm very old, and I am. So I remember when the veterans came back from Vietnam, man, they were treated with people were spitting in their faces. And these kids coming from Vietnam, 20, 21 years old, they were, actually, they didn't even volunteer. Back then we had a draft.
Right.
They were conscripted into the army, sent out overseas, they fight, they risk their lives, they come back, and then people spitting on their faces and calling them murderers. So all of that stuff we have to be aware of, and that's why we have to go the extra mile for our veterans.
Right. And I would think too, especially with PTSD being so common, that must come out a lot towards the end of life. So that can all be really challenging for the families, but also one of the things that we always talk about with hospice is the financial aspect is a huge stressor for people. So how does that look if someone has VA benefits? What does costs look like when it comes to hospice?
Okay, so normally most VA patients or most veterans, after their military life or even during their military life, they might have contributed to Medicare. So those patients, when it comes to hospice, if you have Medicare, the VA doesn't have to pay us anything. Medicare is going to pay us. They're going to reimburse us. When it comes to, let's talk about the veterans that are of low income. Most likely they could qualify for Medicaid. If they have Medicaid or they have disabilities with through Medicare also, then Medicaid is going to pay us. So once again, we don't have to deal with the VA. So we had a couple of days ago, we got a referral from the VA in Houston. They have a big hospital there in the medical center in Houston, and we got this referral for a veteran to receive hospice services. So when I call the wife to arrange everything with them, she says, well, no, I can't. He can't be discharged yet because I'm trying to prove to the ambulance company that we are low income. Excuse me. So I have to prove my income to see if I qualify for ambulance services, because the ambulance service is not included into the VA benefits, which I don't understand that. But then again, there's a lot of things in life that I don't understand, and that's one of them. So with us, we pay for the ambulance. So I told one less thing that you have to worry about, we're going to take care of the ambulance. So then she said, you are? I said, yeah, and we're going to pay for it. Don't worry about it. You won't have to pay a penny for it. And then we went ahead and arranged for the transportation. We got the medical equipment at the patient's home before the patient arrived, because in hospice, we provide all the medical equipment they might need. Sorry about the thing is ringing, because it's got a mind of its own, right? So for a patient in hospice, whether it's a veteran or not, we're going to provide all the medical equipment. That includes the hospital bed, everything, the wheelchair, the walker, anything they need, electric Hoyer, oxygen. We're going to need all the we're going to supply all the medical supplies. That's diapers and wipes and gloves and lotions, anything they need as far as medical supplies. And then the medications that have to do with hospice. So it's a complete package. And of course, they get nurses, they get CNAs that help them take a bath, they get the chaplain, like I said before, they get the social worker, they get the visiting doctor, and sometimes we can get volunteers that will go there and read books with them. And our chaplain goes over there and she sings songs with them and reads the scriptures if they want to. If they don't want to, that's fine. She goes there and talks to them, and she's very funny. She will tell some joke and makes them laugh. So, again, a very complete service. Sometimes our social worker will help them Because not only are we looking at what the patient needs, we're looking at what the family needs. So we might help the family get food stamps or supplemental income or Meals on Wheels. So there's many county and state services that we can get them to apply for, and if they qualify, they get them. So it is a very comprehensive service, and we haven't given my number out because we're running out of time. They're calling me from the cabin and telling me, got it, So I want to give you my cell number. This is my personal cell number, and it works, as you heard the ring. So my number is 281-703-8050. 281-703-8050. And I tell you what, because of my storytelling, but it's factual, I left a lot of things out that we normally talk about. So if you have any questions about home health, caretaker services, hospice, palliative care, assisted living facilities, insurance for seniors, anything in the realm of senior citizens, please call me. I'll give you good information.
Great. Yep, and you guys can find us at avatarhomehealth.com. And all of our social medias, we're on Facebook, Instagram, LinkedIn, all the things. We are at Avatar Home Health and Hospice.
Good deal. Maya, thank you so much.
Thank you.
Thank you for listening and tuning in one more time. And I thank you from the bottom of our hearts. And remember that Avatar Home Health and Hospice cares. Have a great day, and may God bless you.
Estas son las redes sociales oficiales de Aliento Radio: Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube. Encuéntranos como